When an ankle buckles like this, the immediate pain is sharp, but the psychological dread lasts much longer. It's the lingering fear that your mobility is permanently compromised, that you might never return to the sport you love. We usually imagine sports injuries as sudden, violent collisions on a field, but the reality is often quieter. It's the nagging knee discomfort that persists for weeks, or the shoulder that tightens every time you hit the gym. These injuries build up slowly through overuse, signaling that something in your mechanical chain has stopped working. Most people fall into the rest trap. They take a few weeks off until the pain fades, then return to their training, only to have the same injury immediately resurface. Resting a mechanical issue only masks the symptoms. If your joints aren't moving correctly or your posture has shifted to avoid pain, the underlying structural damage remains completely unresolved. To avoid pain, the body initiates protective guarding. This is an unconscious process where your nervous system alters your movement patterns to shield an injured site, shifting the workload elsewhere. This diagram shows a compensation cascade. When the lower back becomes stiff, it forces the hips and neck to pick up the slack. Resting cements these dysfunctional patterns into muscle memory, creating a distorted way of moving that persists long after the injury. True recovery requires an active intervention to repair these mechanical patterns. You have to address the root cause of the movement breakdown, rather than waiting for the localized pain to stop. Sports injury recovery is an act of mechanical correction. Resting a bad habit simply makes that habit permanent. Clinical recovery at Core Chiro Rehab begins with a systematic reset of these movement patterns. The first priority is reestablishing mobility within the joints. Biomechanically, a stiff joint actively inhibits surrounding muscles, preventing attached fibers from contracting properly. This inhibition retards healing by keeping tissue in constant tension. Spinal adjustments restore baseline motion to these areas. Once moving freely, surrounding muscles perform a clean, unrestricted contraction. Effective treatment looks outside the joint at the surrounding soft tissues, muscles, ligaments, fascia, and tendons. Long-term compensation causes these tissues to become swollen and knotted. As seen here, these tangles disrupt the smooth parallel lines of healthy muscle fibers, creating localized irritation and tightness. To resolve these knots, we use targeted tools like IASTM, MLS laser, and PEMF therapy. These treatments promote blood flow and force cellular relaxation in overworked tissues that have been stuck in a protective state for too long. Recovery is only possible when you clear the joint restrictions and the soft tissue tangles simultaneously. Until then, the athlete remains physically trapped by their own compensatory habits. Even after joints move and tissues relax, your brain often retains the memory of protective guarding. You have to teach your nervous system that it is safe to move normally again. Customized rehabilitation exercises target weak muscles, correct poor balance, and challenge your structural stability. We design these movements to address the specific habits that led to the injury in the first place. This active rebuilding phase gradually overwrites compensatory patterns. By reinforcing correct movement under controlled stress, you restore your structural integrity and your confidence in your body. Targeted exercise serves as the neural bridge between the absence of pain and true physical health. Successful sports recovery follows a staged, deliberate progression. It is a process of building a more resilient body, one phase at a time. As shown on this chart, treatment moves from initial pain relief into correcting movement and finally reaches supporting performance. Your plan evolves as your body heals, shifting the focus from managing symptoms to optimizing your actual output. Delaying this assessment allows bad movement patterns to entrench themselves. What begins as a minor strain can easily evolve into a complex, chronic issue if the body is left to compensate on its own. A truly comprehensive, non-surgical chiropractic approach transforms a sports injury into an opportunity to rebuild a stronger baseline. By addressing the root of the compensation cascade, you return to your sport with better movement and a significantly lower risk of re-injury.